and welcome to an insightful session of deliberations being organized by Elites Technomedia along with Dell Technologies. The webinar today will focus on the theme Constructing a Resilient Healthcare Infrastructure for the Future. With innovations like artificial intelligence, the Internet of Medical Things, telehealth, etc., data has emerged as the key component of insight-driven healthcare and medical advancements, presenting unfettered opportunities along with unprecedented challenges. We bring today the best minds from the healthcare sector together for enriching deliberations. Joining us today, we have Dr. Seema Gupta, Founder and Managing Director, Arya Hospital Management Solutions. Welcome, ma'am. Thank you so much for joining us. Dr. Seema Gupta has over 25 years of experience in managing hospitals, which cover a wide spectrum of activities such as hospital design and planning, integrated information technology, with special expertise in hospital information systems, revenue, and utilization, accreditations, and other related healthcare arenas. I once again welcome you, ma'am. We also have Mr. Rajesh Dahol, Managing Partner, Altido Healthcare Consulting LLP, which is a leading hospital planning, designing, and construction company. Mr. Dahol has led numerous project teams at Altido on several hospital projects across 15 countries. He has also worked in public sector reforms with World Bank, IFC, European Commissions, NHRC, municipal corporations, and other local government bodies. Welcome, sir. Thank you so much for joining us.
Thanks, Garima.
We also have with us Mr. Rajendra Kurade, co-founder and CEO, RTW Healthcare Solutions. Mr. Kurade has over 20 years of extensive experience in healthcare IT, product and service software development, digital health transformation, medical imaging, and medical devices. Welcome, sir. Thank you so much for joining us.
Thank you.
Our next speaker is Mr. Kumar Rahul Naman, Principal Architect and Project Consultant, TR Life Sciences. Mr. Naman is building hospitals across India and he has currently designed and built more than 25 hospitals across India, with projects ranging from 50 to 350 beds in Nepal, Bihar, Uttar Pradesh, Delhi NCR, Punjab, etc. He's presently working in around 6 projects. Welcome, sir. Thank you so much for joining us.
Thank you.
We also have Mr. Sugumar Upapati, Enterprise Architect and Field CTO, Healthcare and Life Sciences India, Dell Technologies. Mr. Sugumar serves as the Enterprise Architect and Field Chief Technology Officer at Dell Technologies and has focused on solving business challenges and enabling customers in their digital transformation journey. Welcome, sir. Thank you so much for joining us.
Hello.
And last but not least, we have Ms. Satya K, Regional Sales Manager for Education and Healthcare at Dell Technologies, who will be moderating this discussion. Ms. Satya heads the education and healthcare segment for Dell India, and her team focuses on the growing demands from this segment and helps their clients in digital transformation, infrastructure enhancement, and driving data center and data-centric conversations. Welcome, Satya. Thank you so much for joining us. And I hand over the session now to you to take the discussions forward.
Thanks, Garima, and thanks for introducing the panel speakers, and welcome everyone for the session. And if we are all okay, we can start. So as we discussed, we will take it up in rounds of conversation from each one of you. And I have some interesting questions depending on your expertise and the area of expertise that you come from. So starting with Mr. Kumar, who is the Principal Architect and Project Consultant of TR Life Sciences. I have a question for you with respect to the trends. So what do you think are the recent trends you see with respect to IT and architecture investments in healthcare industry and their relevance to infrastructure, regulatory compliance, patient and staff experience?
So hi, everyone. So basically, to start with the question, see, nowadays, when we meet clients, it is more based, like, being an architect, previously, it was more architectural questions that come out. Now it is like, people ask how we can attach a tab here, how we can add this IT thing, how we can have this whole visualization thing in front of the nurse or even in front of the patients. The whole concept has changed in last 3 years post-COVID, I guess. So to be precise, there are a lot of things nowadays and a lot of companies that have come up with different ideas in terms of IT investments, with eventually taking up to the architecture part, infra part, and as well as the IT infra part, which has nowadays been looping into with a lot of new companies that we are working around with the vendors. So to start with, like, for example, like currently we are doing a project in Gurgaon. So the client had this thing that, we need everything, every IT aspects or every points that are based on different, categories that we are divided from health, catering from nurse stations to the patient information system, collaborating with architecture in it. So definitely to more emphasize on this, there's a recent project that we have done where we have inculcated all the 3-4 tabs and infrastructure system with the medical facilities in all patient rooms in different categories, like we have done a cardiac hospital that has been in that is only specified to the patients with developing all their cardiac things in terms of IT. So we have a few companies as well who has invested in us, where they are developing few softwares where architecture and IT infra will be built in together, so that the management, the patient, and the operations part, all three are kind of merging together. So also in context to cybersecurity and other parts, definitely our team looks into cybersecurity is now a very major concern nowadays, because as we are developing the IT infra, there are a lot of possibilities of data security, leakage, phishing that happens a lot with our clients right now. So those are major aspects. There are a lot of pros, definitely, but we look into current scenario, there are a lot of cons as well, while development of definitely companies like you, like Dell, definitely that would help us a lot in terms of how we can integrate more better ways to there are a lot of small companies that are developing it, but we are not pretty much satisfied with them, that how they are building up basically the data leaking is a very, very concern with all our clients right now. So yeah, something that is one thing that in a whole I would like to say.
Perfect, Mr. Kumar. So that starts the session for us with respect to overall industry, how it is looking at the architectural and the infrastructural changes. And based on that, I would put my second question to Dr. Seema. So Dr. Seema, you being the founder and managing director of ARIA Hospital Management Solutions, and you have done a lot of IT in deployments, and you have hands-on plus the industry knowledge of what's going on in the last 2 decades. How do you look at the healthcare industry and the digital transformation that's going on now?
Yeah, I think it's an interesting question. Healthcare expectations from IT have been like the expectations of a beauty queen. We want world peace and we want it yesterday. The expectations from IT, from healthcare, have been even worse. So I seriously don't think that there's a mismatch of expectations. I think they live on 2 different planets, which is why we don't have too many happy clients and we don't have too many happy vendors. Where it has succeeded, it has been spectacular. And the doctors, to the nurses, to the ward boys, to the patients, everybody feels the difference in quality of implementation. I think part of the problem was every IT provider is selling a product. They have buyers, they have computers, they have barcode scanners, they have technology to sell. What the hospital is looking for is a business solution. And unless we get a solution in place, which means we need help in implementation, we often, with the hospital, I work with both the sides. With the hospitals, they don't even know what they need sometimes. They ask you things at 50,000 feet. I can see a few people smiling, and I know exactly why. So you will have grand visions being presented in PowerPoint presentations of how will be this absolutely fabulous, totally enabled, jargonful, this wonderland of IT. And when it comes in reality, all you're doing is about billing, which probably Tally would have sorted out. So the discrepancy of what we think we're going to get and what we do get is huge sometimes. And the problem is not on one side, as usual, it's on both the sides. The experiences that I've had made me very clear on what we need to do as well as what we don't need to do. Because the successes that have been far and few have shown how easy it is. It's not difficult. It's not insurmountable. The processes need to be cleaned up before we get the solution in. So you need to know what you want. You need to know what is available in the market, what suits you best. And then, of course, the vendor needs to be honest about the costs. When you're putting in a solution in place, if you don't put it in key and all the places that is needed, it will go on very quickly to paper. Once you have paper involved and you have little gaps, the process will never be successfully transitioned into a proper solution. This has been essentially the main couple of problems that we saw happening in that. Once these were sorted out, having a good consultant in place is absolutely essential. You would go and buy wires, you would go and buy switches, but you would get an electrical consultant to design it for you. Also, you would not employ the consultant to switch on the lights and plug in the appliances for you. So you need to train your guys. They know what needs to be used. They also need to be trained on safety. The training is constant. The turnover, as you all know, is very high in IT and it's very high in healthcare, which makes a recipe for disaster because you talk to one guy, the next guy who comes has no clue of what your problem was. Both the sides need to document and put this down on paper, have a system of touching base every few things, and have a consultant who's an honest broker between the two. This is, I think, primarily what made this succeed. Also, discerning buyers are really important. The difference between a good vendor and a good high quality product cannot be replicated by a cheap knockoff. And that's a cost that the hospitals must learn to say yes to right up. I think that's pretty much my take on that. The vision with IT, the digital space in healthcare is amazing because healthcare was always hospital driven. It is now already in clinics and diagnostic centers. Majority, bulk of our work has moved outside. Going into homes and doing home care is the next big thing that everybody wants a chunk of. I work with the Israelis, I work with Americans, I work with Apollo, with some of this. When you have the full base ready, when you have the cardiologists who are reading the ECGs, when you have the gynacs on call who are actually watching this ICU things, it works beautifully. When you again don't have, you expect the computer to do everything for you, it's not an item work. It's you need the entire team of cameramen, of your directors. You need your base key team in and committed and being paid for the service. Nobody does stuff free. So if you have a doctor who you think is going to report out of home, they're not going to do it. You wouldn't do it and you wouldn't expect them to do it. So with a few of these things, the service as far as the patient is concerned and the earning potential as far as the hospital is concerned is limitless right now, especially with Ayushman Bharat coming in. If you see what happened with Rajasthan with Bhamasha, which is the precursor of Ayushman Bharat, and the rest of the stuff that's happened, the change has been so dramatic and so quick. All our preconceived thoughts of, how, people won't be, old doctors won't touch it. They will touch it. They get paid, they will touch it. So this has happened quite well. And a hospital gets paid, they will drive it. So that's my thought on this.
Okay. Thanks, Dr. Seema. I think you gave us a quick look at what the vision of hospitals and what's the reality that happens and how it can be bridged and what's the role of a consultant and how digital transformation really helps them to look at getting things more in line with what they expect. I think that was briefly covering the role of a consultant for sure, and how hospitals can look at it as a premium investment to ensure that they get the right outputs in their at the ground level. Thanks for that. That was quite informative for us. And passing on to the next panel speaker, Rajesh Daul, who's the managing partner for Altido Healthcare Consulting. And the question to him I would like to ask is with reference to what does the healthcare clients look for when approaching consultants for Greenfield projects?
Yeah, thanks, Satya. As briefly introduced by Garima, at Altido we provide turnkey solutions and we take on the entire life cycle of the project. And we work in India. We are also into design build services wherein we involve in the entire execution of the hospital, right from civil engineering, IT, and interior finishes, along with clinical services. So in case of greenfield projects, basically our clients are looking for a DPR to start with. So that entails a feasibility study and a comprehensive architectural designing planning services. So in feasibility, we consider IT infrastructure in the capital requirements. However, the type and make of an IT infrastructure is not clearly planned in that stage. During the design stage, mainly the service part cover the IT requirements. So if the client has a keen interest or understanding of his requirement, then they have a direct request to incorporate a specific system. Else, we work out the IT infrastructure as per the budget and considering future prospects of the IT system. So as we all know, gestation period in greenfield projects is much higher as compared to the brownfield projects. So we have witnessed a shifting trend from greenfield to a brownfield projects. So a robust IT system places an important role, right from the assessment of the existing infrastructure and to incorporate a new infrastructure to make that building, more acceptable or recommended for a hospital. So currently we are doing few brownfield projects, like we are doing a project in Mauritius, we are doing a project in Srinagar. So it was a Srinagar, it's a hotel building. So converting that into a hospital, it's more challenging, right, as compared to a greenfield one. So we have to develop a IT system that is a very flexible, so that it can be articulated as per the existing building to minimize the process waste, to increase the efficiency of the health setup altogether. So currently we are not working with any particular IT company. Basically it materialized at the time of execution of the IT system. So we call for open bids and we prepare the specifications as per the patient flow and information flow. I strongly believe technology shall be the backbone of a resilient healthcare infrastructure in coming times post-COVID. Our clients are looking for predictive analytics, AI in diagnostics, lean paperless operation systems, and to increase their efficiencies. So as a consultant, we take a 360-degree approach in defining IT systems for our clients during design phase and thereafter. Basically, I will emphasize on predictive modeling as the future of healthcare. There are many companies working along with the lines of predictive analytics through AI-enabled systems. I read few articles about predictive analytics wherein they do early detection of patient health in ICUs, in wards, and also at home. So this is something which is very interesting to understand. We are currently working with a group of hospitals to develop such predictive technology that can be incorporated right from the concept stage. So that is the crux is data. For predictive health, data is the crux. So getting data in an unorganized market like India is very difficult. You understand, hardly, I guess, 5 to 7% of Indian healthcare system is working on IT. Rest tier 2, tier 3, you forget. You cannot get data. So basically, we need to work on a predictive AI model wherein we get relevant data, to create a very robust, very prudent IT system. So rest, architecture, everything gets in place. Thanks.
I think that was, I think Sumar also must have found a lot more interesting points there, because it has so much of a sync with reference to what we also speak from Dell point of view with reference to healthcare solutions. It was so much in alignment with that. And yes, we do see, we are working with AI/ML and predictive modeling and all that, but we never thought it could be even starting from the greenfield. From the day one, you could involve, or you can build solutions based on that, or that can come in place for your consulting efforts throughout the cycle or the journey. That way, I think that was a very interesting point to us. And yes, we have taken it for our own consumption to check if our clients are also thinking on these lines. When you mentioned about the data availability and data not being sufficiently available with most of the hospitals or the healthcare industry today, I have Mr. Rajendra Kuradi, who is the co-founder and CEO of RTW um, Healthcare Solutions with us. And to him, I have this question, which is so much in line with your point. So, Mr. Rajendra, what's your take on transforming the traditional healthcare infrastructure into an integrated smart hospital solution? And how do you see it as a benefit to the hospitals and the patients?
Yeah, thank you, Satya. My name is Rajendra and I lead R2 Healthcare Solutions. It's a healthcare IT startup company, and we mainly work on smart health projects, specifically in the area of tele-ICUs, telemedicine, and integrated operation room implementation. So I'll just give you a few examples that we have done. Right. So the telemedicine, because smart health or a smart hospital would include IT infrastructure, smart devices, internet, and then enabling, the scalable consulting. I mean, healthcare consulting. So end of the day, what matters is the value that you bring with your technology. It should not be just for the sake of technology we should implement. So there are a few things. So to start with, COVID has been a game changer for healthcare IT companies. So a lot of digital transformations are happening due to COVID. So one of the examples that I can give you, so when the COVID happened, so there are a lot of scarcity for the hospital beds, intensivist, and there are huge risk of infection. So what we did was we worked with the government hospitals and also private hospitals to set a command centers in the COVID war room. So in fact, I myself actually went inside the COVID ICUs wearing the PPE kits, kind of did the internet, I mean the networking to each bed and integrated the entire COVID ICU beds through the smart solution and enabled or created a command center in the war room. So with that, what we did was we have enabled the intensivists sitting in the war room, managing the ICUs. So we had developed, for example, one of the TB hospitals, like they admitted the first COVID patients in India. So we had 100 beds of COVID beds we created, and the virtual command centers we created. So in that sense, what is the value? So one is where instead of doctors going inside ICUs every time, probably once in 2 hours, so we avoided the entire proceedings. And out of 5 times, only 1 time they would go inside the ICUs. Rest of the 4 times so manage in the command center. So that will help them to avoid the risk of infection to the doctors itself. So we built that one with the government hospitals, and then we integrated a network of hospitals through the command center. So wherein the hospitals can manage their ICUs or probably OTs, OPDs, and HDUs through the virtual implementation. So that's one thing. We also did a project in Gujarat where we have connected around 15 ICUs and hospitals at a district level into the command center in Ahmedabad, where we have a group of doctors sitting in Ahmedabad managing those 15 ICUs. And in the tier 2, tier 3 cities. So that is very important that we need to look at, where in corporate, in the medicine availability. But if you go to a rural side, there is a huge need of infrastructure plus clinical consulting services. So we did that. In fact, we set up a command center in Bangalore and enabled ICU consulting to a place called Chikbalapur, Tumkur, and Bijapur, wherein those hospitals were hesitating to take the ICU patients because they don't have people, experts. So we brought in those expertise through the virtual integration, and then they started increasing their ICU admissions. So in February, for example, there was monthly 111 ICU admissions. Now they are seeing around 40 to 50 ICU admissions per month. This is just through the technology. Okay, so that is very important. And then that is the kind of the success story that I wanted to share. But as far as the smart health implementation is concerned, we are working with a few government hospitals, Greenfield projects, where I lead the IT infrastructure design and implementation, mainly to implement hospital information systems and electronic medical record. We're talking about the kiosks that we enable the self-registration counters, and then making the complete digitization and transform the technology to the ICUs and then OT, and then back to home. So we are tracking the complete life cycle of the patient from OPD to ICU to the OT to a post-operative care. So that is how actually we are trying to align, and that is the kind of solution that we built around the smart health. And so yeah, so that is my experience, because I was on the field to do this during the COVID and post-COVID. So that's what I can say. So it's more about enabling the IT to the actual value that you bring for the critical care services.
Wonderful. So another example of how technology can be a blessing during times of pandemic. And I think your organization has really helped many patients and doctors and the hospitals in overcoming situations which was life-threatening. That was a wonderful anecdote to talk about, and we could see how digitalization is taking shape and building. And that too, you said first you set it up in a government hospital, and then you have expanded it. And I'm sure that time a lot of data was coming to us from the government themselves, a lot of report and information which was helping the common man and the public was coming from the government, and I'm sure you had a role to play. And the command center you spoke about is certainly a great, innovative, thoughtful item, a concept, I would say, and I'm sure it's going to take shape, and many more hospitals will go for it over the time, such that and India by itself will be a modern healthcare infrastructure that would be coming up over the time. And I'm sure
absolutely
we heard from different consultants here coming from different background expertise, and based on your experiences and expertise, you were giving your answers in which were like which were touching upon different zones of healthcare, and that was very interesting to listen to each one of you. We have here Mr. Sugmar, who's our Dell Technologies healthcare consultant as well. And I would love to have him answer a question for me as part of this panel. So, Mr. Sugmar, how can IT OEMs bring more value to improve the consulting efficiencies?
Sure. Thanks, Satya, for the question. But I think I just wanted to echo some of the thoughts all the other panels have been bringing about. I think the expectation versus reality, right? And I think we all have been trying to work. And I particularly like what Dr. Seema was highlighting about the expectation, and they really don't know what to ask for, and they end up getting something that they never expected. And that's something which we always try to bridge. And as healthcare consultants, our objective should be more holistic. While it is not just from our point of view, it is also from the other side as well, the healthcare providers, to be more open in terms of what they want to achieve, and more proactive in terms of what they are trying to do. I think a few other points that like even Mr. Rajendra was highlighting about the telemedicine solution and remote patient monitoring that you can do from an ICU, and also how Rajesh was highlighting about the solutions that he has worked upon. The Greenfield solutions are a lot easier because you're starting afresh, right? So there is no backlog or technology debt in terms of IT that is causing the hindrance. So while if you look at what is the trend overall that's happening, Rahul talked about it initially, I would say the expectation is moving more and more towards a predictive or a proactive care compared to an episodic care that we have always been used to, right? So we always visited hospitals when we had some illness, and the doctors used to help take care of it. But today we are becoming more and more health conscious. We are becoming more and more aware about Google being the best doctor available today, right? We all get to see that all the time. So how do we make sure that the value that consultants provide to the healthcare industry is able to bring them closer to the patient and add that value, right? So the proactive care part of it, when it comes to, there are many things that everybody looks for: integration of the health devices that they are wearing, wearables like smart devices, smart watches, and whatnot. And taking that further to when they come to the hospital, how fast are they being addressed, how much time do they spend in the hospital, and also what is the kind of care and how easy it is for them to see their own data and they are in control of their data, right? So with respect to the OEMs, if you look at like Dell Technologies, we work with healthcare providers across the globe, and healthcare providers from an hospital and the life sciences market. At the same time, also with the software and the capabilities providers, like many of the ISVs that create solutions that work together. Now, as we all know that the hospitals and the life care solution providers generally are not technical to get to the IT part of it. That is not their specialty. They want to focus on what they can do best, which is to provide care. And as ISVs, they have created solutions. So I think consultants like us, the job of putting them together and converting those clinical requirements into more of an IT solution that can basically serve the patient and make their life a lot more easier. So in that aspect, like some of the points that we discussed, the future or what they would want to do in the near future or maybe further as well is something that's unpredictable. So some of the things that we take into consideration is to ensure we are ahead of the technology curve, because things like digital twins is becoming more and more real today, right? Use of AI to do a predictive analysis of your or diagnostics for your patient and reduce the burden on the radiologist and the doctor to need to spend more and more time, right? Use of remote connectivity and remote patient monitoring so that the pool of a few doctors can suffice the care provider to tens or hundreds of patients, like what Mr. Rajendra was highlighting, right? All of these capabilities are not something that you can think of it and immediately deploy it today, right? So some of them have been a lot of work that you guys have done over a period of time and built those solutions. How do we take it forward and replicate that so that not every hospital takes the same amount of time the first one took, right? I think our endeavor should be to be able to replicate that solutions that we have been able to create, which would have taken a few months' time, to make it into a ready to consume solution that any other hospital who wants to go for it can immediately go for it, right? Which shouldn't take multiple months or maybe a few years, right? In that path, if you look at what Dell Technologies have been doing, is we work with all the major ISVs that we can think about, Siemens of the world, Philips, GE, right? All of them, right? Agfa, Cerner, any name you can think of, we work with them to create and co-create solutions that we are able to take it to the healthcare providers when they need, right? And second, how do we also stitch together these capabilities? Like EMR is the first and foremost most hospitals look for when they go for a paperless as a vision that they start with. But beyond that, the amount of data deluge that happens, because the moment you start digitizing just the images, for example, X-rays or CTs or MRIs, the amount of data that gets accumulated is massive, and right. And these data, there are all the regulations in place to hold the data for a long time. How do you ensure that we follow the regulations and that data is available to those who want to, who are interested in it at whenever they would want to, right? Maybe it could be a 5-year-old data to see how, for example, cancer patient or any particular chronic illness, how do you see the improvements or deterioration of their health over a period of time? So how do you visualize the overall health and the vitals that they have been able to accumulate over a period of time? So managing this data, ensuring that all of this work that happens from a smart hospital point of view, to be able to integrate right from the patient entering till the time they leave and even post they leave the hospital, right? So as Dell Technologies, our vision is to touch 1 billion lives by 2030, right? And in terms of healthcare being one of the primary beneficiaries of the technology that we develop, we have been working endlessly with many of the healthcare providers. To give you an example, the non-communicable diseases program that is run by Ministry of Health and Family Welfare. We are a technology partner, work along with multiple healthcare providers like AIMS, Tata Group, and everybody. And we have sort of digitized about 160 million patient record as a part of this platform. What this does is it sort of reduces the burden that it puts on the healthcare providers, because these people who, if you are able to proactively identify their situation and are able to address their future needs and taken care, they don't come to you as a terminal illness patient who's going to take much more load on the healthcare part of it. So I feel as OEMs, the responsibility is to be able to stitch together all of these things, put together a robust architecture in place which can be taken forward and repeatable and very open as well. So because today we are talking about digital twins and AI, tomorrow there could be something else. How does the architecture that you're building today is able to handle the future, and it's not going to be sitting as an isolated setup? And how do we put them all together so that the overall outcome for the patient is taken care of? I think that's our look forward into this area, if you really see. And I think that's where I'm seeing a lot of points from other panelists as well. I think that's the same thought.
Perfectly wrapped it up, Sukumar. Thank you for that. I think we spoke about the consulting and the consulting related expertise and work around. We spoke initially, and then you have clubbed it with what are the offerings from the IT perspective, which can make their conversations with their clients be more, I would say, meaningful with reference to an IT infrastructure consulting. If that is part of their role as well, then how can they build it more? Or I would say from whatever you spoke, most of it makes it look like a modern hospital, modern healthcare infrastructure, or a digitalization. These are the things that every single client we visit express as their vision, where they want to land in the future or they're working on now. Like Dr. Seema said, possibly they may land up in their vision or they may land up somewhere lower, but doesn't matter. They all have the thought in them. They're all having the vision in them, and they all want to drive towards that. And I think that's a good intent that has popped up in the recent days and the recent years. And we see already a lot of new modern infrastructure and modern IT based organizations and hospitals who are giving great patient experience and staff experience are already there. And many of them are following, and some of them are leading the way. Now, as a common question to all of you, I would like each one of you to take a minute or two and share your thought about this one common question. After you all did, and Mr. Sukumar has given his view about the IT in specific, and you gave the consulting point of view. Will joint efforts of IT OEMs and consulting firms benefit the healthcare clients? That's a question to all of you. And at which stage do you think they should start working together? That's a question. And yeah, I would go back to Mr. Kumar to start. Unmute yourself, please.
Can you hear me?
Yeah.
So yeah. So I guess to start with, it's always a thing that nowadays I suggest all my clients. And IT is now, it's not a last part of your project, it's the first part of your project. If you are having a vision of next 25 years down the line, or at least 10 years also, if I may say. So I think so this is one thing that people need to understand, that investing in IT is and starting with it, integrating architecture and infra with IT at the start is very major aspect right now. And the clients need to start, and even the funding and the fund management that the clients and the healthcare owners have in mind, they also need to pursue it, that this is one thing that it is very important, and to give a proper proper budgeting to it, and understand when to start with respect to what the we as healthcare consultants suggest them, or even eventually other even IT consultants also, they in big projects we have IT consultants. So I guess this is one thing that a major thing that I would like to say on this part.
Cool. Yes, Dr. Seema.
Maybe, yeah, I can add a little to it. I think for me, it begins at the time that you're doing your feasibility. Your numbers come from IT. I need to know what the IT is going to add to my bottom line. Not just saving costs, because that's always diffuse and it doesn't really pan out. I need to know where my revenue is going to come in, which would not have come in if I didn't put these IT. And then how much it's going to cost me. So I think it's important that we start thinking of it right in the beginning. So the number of OPD consultations, how do you increase that without increasing the payout to the consultants, or even increase the payout, have more numbers. Similarly, diagnostics. So your radiology, your pathology, how do I increase the numbers without that can totally utilize my path lab without spending money on marketing and payouts again. So everything with IT needs to justify itself with ROI, and that has to happen in the beginning. If it doesn't happen in the beginning, then you already have a process, then you are trying to automate, which works, but is not the best way to go.
So that's your view about it. And yes, passing on to Mr. Rajesh. So
sorry, just one more. Could I add one thing? The second vital point of this is the operationalization. So when the day you turn up, you go live, maybe a few months before that and a few months after that and a few touch points after that keeps it going. Otherwise, again, it becomes, you had a plan, it didn't happen. But you made to make
so that is
operationalization is very important.
Correct. So while consultant and the OEMs have to work together to meet the deadlines, the deliveries, the deployment, and going live and ensuring post-deployment support, and until they are smoothly running,
there can be no daylight. There can be no daylight between these two. They have to be seamless, and it's that's where having a good company. I work with Dell. I've worked with other guys too. It makes a huge difference when you have a big company that is answerable, is accountable, is not fly by night. And I think that's important. They have to work as a single unit, not as three components.
Well said, Dr. Seema. So on to you, Mr. Rajesh.
Yeah, so initially I used to think, IT should come at the design stage, but post-COVID, what I understand that before feasibility, even, we need to have an ecosystem wherein we work together with the IT companies like Dell or, bigger companies to, create a prototypes, for a disease-specific prototype, because now we understand, tertiary care has gone down to standalone hospitals. We have seen mushrooming IVFs, we have seen orthopedic hospitals, we have seen oncology setups, chemotherapy setups. So everything is going at a micro level. Everyone is going at a standalone system in the market. So rather than pitching to the client that we are working with X company and this is the solution, we should make a solution first as per the market, and then I guess we should propagate that, and then I guess it will be a win-win situation for both the companies. We can, for example, if we create something in chemotherapy centers and we are able to sell it, then the design will eventually, we will be able to sell our concept, we will be able to sell our designs, architectural drawings, everything, and then eventually, your technology will also be sold off to these guys. So now is the time that we create an ecosystem. We work together right from the zero phase before even pitching to the client. Once we have a solution for each and every aspect or disease pattern or a specialty, I guess the world is ours. There is a huge demand. We have seen in India, hardly 5-7% of healthcare goes to the metro hospitals, metro cities. Rest, everything is nascent, everything is quite virgin. And be it India, be it Africa, it's a huge market. So I guess it's better to create an ecosystem between consultant and a company like Dell and develop solutions, and then to market them, and then I guess it will be a better approach. And if you talk about existing projects, there design is the best phase wherein we get an IT consultant who work in tandem with us, and we design the flow, everything architecturally.
Right, well said. I think one is supplying to the demand in the market, or what is asked, you satisfy by offering that. The other way is to create a innovative a solution which will have its own benefits and social costs, or the benefits to the hospital and its respective internal and external consumers. And if that solution can add value, and we can create a new demand, and that's where an OEM and consultant can come together, because you know the industry, you know the clients, and we know the product and the technology, and that's how we can handshake very well. And that's a great point. Yes, on to you, Mr. Rajendra.
Yeah, so I think I'll just try to touch upon a particular aspect of interoperability. So when you buy a systems or a software for, so IT solutions for hospitals, interoperability is very important thing at this particular time, because hospital will buy software which doesn't talk to each other. So, and again, you will run the software independently. So interoperability and standardization has to be taken into the consideration when we really design the IT solution. So in fact, for example, we are doing a turnkey project of 200 bed, 50 bed hospital, so government hospital, where I lead that IT integration effort, wherein, for example, we buy devices, medical devices like ventilators, syringe pump, or patient monitors. We make sure that these devices are integratable, because without the network enablement or an IoT element of these devices, you will not be able to talk to those devices. So that we buy these infrastructure, and we expect that system should be integratable. So overall, smart health, when you design, so you need to consider. So OEM and the consulting companies really need to have that understanding and get together. Recently, for example, in this hospital, like when we did, so I called up like 5 consulting companies that are contributing to this, and then we discussed a common framework, so that we created a checklist, make sure that everybody understands those checklists, and then align with that to purchase the software solutions or medical devices.
Great. I think that again is another point which is little you're getting deeper into this, where you're saying that how we can collaborate and work together and ensure that we are able to establish digitalized technologies. And since you are into the smart health solutions and integration solutions, I'm sure your play along with an IT OEM or an IT vendor is, or technology as such, is very high. You're totally having a integrated working styles with them, and thanks for that, Mr. Rajendra. Yes, Mr. Sumar, you can share your thought about it. You had heard all the 4 panelists here on their thoughts about this, and that would help us to wrap the session, and then we can hand over back to Ms. Garima.
Sure, Satya. I think as we are living in an age where one organization or one person cannot solve everything, right? I think collaboration is a critical component here, and whoever brings in that value in terms of their specialty, right, is going to add value to the overall outcome, and thereby can make all of them successful. So I think we all work together, and I think in terms of the OEMs versus the healthcare consultant versus ISVs and partners who are able to implement it and execute it and operate it, I think it's the collaboration that is important. And to answer your question in terms of when should IT get involved, I think I would say much before even all the feasibility analysis. I would say when vision is created, right? I would say sometimes even before, right? Many a times we have seen, for example, COVID, right? When COVID happened and we all were faced with immense challenge of non-availability of hospital beds, non-availability of diagnostic mechanisms which could turn around faster and stuff like that. Solutions were built which were able to diagnose an COVID patient with just a chest X-ray instead of having to go through a swab test, right? Now, if you are a doctor and you are looking at bringing in some solution which can reduce the time taken for the diagnostics, you would be thinking from your perspective of what are feasibilities are there, but somebody has already done it and implemented it. I think the key here is to be able to keep an open mind and start looking at outcome and see what can all these specialty vendors provide in, right? It is possible that somebody else have already done that elsewhere in the world. And given the context today, if you look at India being a sort of a startup hub, we are seeing enormous amount of healthcare startups coming up every day, and they're solving one or the other problem, which to look at many developed countries, the so-called developed countries are way behind, right? I definitely, while I work with the Asia Pacific region from a healthcare point of view, I see India's development, India's achievements in the last few years is surpassing many of the so-called developed countries, which we all thought were ahead of us in terms of technology. And being a country which naturally has the intellectual capability to build and solve challenges, I think we are very well placed, and we sort of lead this healthcare point of view. If you ask me, we lead this campaign as Indians. We are able to drive it much ahead of many other countries are doing today. So in my thought process, I think if you have a problem in mind, solution is easily achievable. I think if you are able to define your problem properly, the faster you get to the solution. And there are enough capabilities, specialists, technologies available in the country who can solve it for you. It is just a matter of asking the right question, like what Dr. Seema was highlighting in the beginning.
Yeah, rightly said. And I think one is either the problem or their vision, whatever they would like to, because I'm sure it is not a one straight constant factor. It is a combination of multiple variable dynamic factors that come into play, like a budget, time, constraint of people, or availability of resources. A lot of things comes into play, and if all of it is in place, I think then the collaboratively with the right people, with the right product, right technology, everything will fall in place. The gap happens when that effort to identify first what is that I need and who can give me that. If that identification, if there is a gap in that, then the gap continues or it becomes only bigger, which can be controlled in the beginning. So when the vision is built, or when the ask is built, or the problem is defined, if it is defined well, I think the solution is there, and each one of us are working towards building solutions for them. So I'm sure with a lot of efforts coming from the different people here and across the country, I'm sure all hospitals and the healthcare clients should see some great changes over the time. And with that, thanks to each one of you, I would like to invite back Garima to close the session.
Thank you, Satya. Thanks a lot for, and thanks to all the panelists, for this wonderfully insightful session, where we've learned a lot, the defining role of IT in, redesigning the healthcare ecosystem. Of course, collaborations is the key, as, we've understood. And let's hope, we look at future collaborations, getting formed here so that, it's the larger, better good, happens, and healthcare and everybody, gets benefited from it. So thank you so much, everybody, for joining us today. And it was a pleasure to have you with us. And thank you very much, Satya, for wonderfully orchestrating this discussion. Thanks a lot. Thank you so much for joining us.
Yeah, thanks a lot.
Thanks, everyone. And thanks, Garima.
Thank you.
Bye.
Thank you.
Bye.
Thanks.
Bye-bye.